The Huntingburg City Council is moving towards plans for developing the former St. Joseph's Hospital building. More from last night's council meeting, plus smoking in the workplace, what businesses lose from it, and how it could affect you if you're looking for insurance on the new health exchanges. And Kurt Guxell previews tonight's sectional football matchups coming up in sports. All of that and much more is up next here on the 18 WJTS News. Hello, I'm Bradford Raths. More on our lead stories momentarily, but we begin this evening with the second Huntingburg man to be arrested this week on felony child molestation charges. Back in August, Huntingburg Police and DuBois County Child and Family Services launched an investigation into allegations of child molestation against 23-year-old Trenton Torres of Huntingburg in response to an incident involving a girl under the age of 14 that took place sometime between July 3rd and July 7th. Torres was brought to the Huntingburg Police Station back on October 2nd for further questioning by detectives. Then on Wednesday of this week, a warrant for Torres' arrest was filed through the DuBois County Circuit Court. Detectives spoke with Torres at about 10 a.m. yesterday morning, and he was taken into custody at that time without incident. Torres was lodged in the DuBois County Security Center on a Class A felony count for child molestation. He is currently being held on $10,000 cash-only bond. As I mentioned a moment ago, Torres is the second Huntingburg man to be arrested on felony child molestation charges this week. 24-year-old Francisco Perez was arrested back on Sunday after an investigation revealed that he had molested a girl under the age of 14, starting in December of 2012 and continuing into April of this year. A project for a former Huntingburg hospital property is continuing to take shape. Last night, the Huntingburg City Council voted to contribute various funding to redevelopment of the former St. Joseph's Hospital property into senior housing units. Earlier this week, Cincinnati-based Miller Valentine Group and Huntingburg Partners LLC announced an agreement for the former hospital building. The project will create an estimated 48 senior living units, according to company officials. The project is likely to cost roughly $10 million to complete. Huntingburg Mayor Denny Spinner says from the city's standpoint, funding for the project will be dependent largely on what the state of Indiana does.
The funding will come is slated to come from the Indiana Housing, the IHCDA. Should that be approved, then that'll trigger some mechanisms for the city of Huntingburg. What we committed to this evening was that we would be providing $300,000 in economic development incentives for the project, and those could come from a variety of sources.
Spinner says in addition to the $300,000 in economic development incentives, the council agreed to commit $50,000 for improvements around the property, and these would include stoplights, streets, sidewalks, and fire hydrants. The $300,000 in economic development incentives could come through TIF or tax abatements. Those would be able to be given out over a period of 10 to 15 years. Miller Valentine Group will be applying for rental house tax credits through the Indiana Housing and Community Development Authority next month, and if those credits are approved, construction is set to begin in the fall of next year, and units would likely be available for rent in the fall of 2015. The hospital originally filed for bankruptcy soon after its 2007 closing. The building was purchased back in 2010 by St. Joseph LLC, which was a partnership formed by Dr. Yaz Mahmood and 3 other doctors. Mahmood bought out his partners last year and then formed Huntingburg Partners LLC. Tobacco use in the workforce continues to be an ongoing problem, and one regional organization is seeking to combat it. During yesterday morning's Spencer County Regional Chamber of Commerce monthly breakfast, Casey Williams with the Evansville-based HCP of Southwestern Indiana's Tobacco Free Initiative spoke on the impacts of smoking in the workplace. The presentation included data on money that businesses lose each year in productivity and additional medical costs for those who smoke. Williams also introduced a 3-part plan for businesses to help employees to quit smoking. He says it takes a lot of effort on the part of the business to help combat smoking amongst its employees.
If businesses would like to, reduce tobacco use in their workforce, it's really important that they, one, implement a policy that would suggest that tobacco use is something that we are trying to reduce at this business for a number of reasons: the cost on the business, and more importantly, the well-being of the employees. And along with that, you have to have the proper cessation. You have to offer employees opportunities to get help quitting, because it's a very hard thing to quit using tobacco, and businesses have to follow through, not just with the policy but with the support to help that happen.
The consequences of smoking are also extending to the Affordable Care Act and specifically the health insurance exchanges. Williams says being a smoker will have even deeper financial consequences for those looking to the private health exchanges for insurance.
Well, the biggest thing to think about with the changes to healthcare, if you're uninsured and you're going to the public option, the healthcare exchange online, if you're a smoker, you could be seeing 50% higher premiums than if you were a non-smoker. So now more than ever, financially, it's really going to hurt you to be a smoker.
In recent years, several cities and towns across Indiana have implemented smoking bans in public places. Williams says that although these bans do make a difference, help for employees to quit still has to be made available.
When a business goes smoke-free, or when an ordinance is put in place, we have to also offer the people affected by that ordinance help quitting. So employees will have a change. If they're used to smoking during their shift, it's going to be a change for them. But it's really a good thing, because ultimately it's going to help them make that change and go tobacco-free.
According to data from the Centers for Disease Control, or CDC, the total economic costs of smoking come out to just under $3,400 per smoker per year. The figure includes over $1,600 in excessive medical expenditures, nearly $1,800 in lost worker productivity, and $8 in neonatal expenditures that are attributable to smoking. For more information and statistics on smoking and the workplace, you can visit indianaquitline.net. The number to reach for the Quit line is 1-800-QUIT-NOW. This weekend marks an opportunity for residents of 2 local counties to dispose of their unwanted medications. In Spencer County, Medicine Cabinet Cleanout Day is set to take place tomorrow from 8 a.m. till noon Central Time. The event is being put on by the Spencer County Substance Abuse Council and the Spencer County Solid Waste Management District, or SWMD, in collaboration with several local volunteer fire departments. Fire departments in Dale, St. Meinrad, Santa Claus, and Rockport will serve as the drop-off areas for people to dispose of their unwanted or expired medications. Deborah Steinkamp with the Spencer County SWMD says the common practice of flushing old medicines down the toilet is beginning to cause problems for water and the environment.
If you are flushing that down, if you're on a regular water system, there's a lot of antibiotics going through your water treatment facility. They have found places in the past where it has killed those good little bugs that you need to break down in your water system. Or if you're on a well system and you're on a septic system, flushing them down the toilet, we know that those aren't necessarily always contained properly, and that can leach out and get into your water drinking system also.
Problems with old medicines are also evident in substance abuse. Natalie Bolin with the Spencer County Substance Abuse Council says substance abuse among younger people starts with old medicine that's left in the cabinet.
Prescription drugs are highly used with teenagers. It's very easily accessible. They can get it out of mom and dad's cabinet. They can get it out of grandma and grandpa's cabinet. They like to use like Loratabs, any type of pain-killing medication, any type of medication that's psychotropic medication. So that could be Ritalin, your Xanax, things like that. They like to use those.
National data shows that prescription drugs are highly abused, even more so than illegal drugs. Nearly 1 in 5 teenagers have used narcotic pain relievers for non-medical purposes. The Medicine Cabinet Cleanout Day also coincides with tomorrow's Drug Take-Back Day that's taking place here in DuBois County. The 7th edition of the nationwide incentive seeks to prevent the theft or abuse of prescription drugs. The program is free and anonymous for folks to use and has been highly successful. Last April, 371 tons of prescription drugs were collected from 5,829 sites across the country. The collection sites are operated by the Drug Enforcement Administration in conjunction with state and local law enforcement partners. All state police posts in Indiana, including the Evansville and Jasper posts, will be participating in the event between 10 a.m. and 2 p.m. tomorrow. There will be 2 additional sites open in DuBois County, the Ferdinand Fire Station on 4th Street in Ferdinand and the Huntingburg Fire Station on 1st Street in Huntingburg. Both sites will be open from 10 a.m. until noon tomorrow. Coming up after the break, temperatures are set to reach back into the 60s in the near future. I'll have more on that in your local forecast, sports with Kurt Gooksell, and Inform featuring Jasper K-9 Officer Adam Bauer. That's all up next here on 18 WJTS News. Local people watching local people.